Hi, everyone. It's Dr. Jen. Welcome to the Peptide webinar. And I have been kind of promising on social media that I would just talk like for an hour about peptides or so and just go over some basics, go over a few peptides, talk about what I've seen in practice of using peptides for the last decade, and also what I think is going wrong with them. So there's a lot to talk about and super excited to have this out there. There will be a replay. I will just probably keep this webinar just up for people to share too, because I will be going over a lot of basics. And, if you're taking peptides and you have a family member that's curious about them, you can just share this with them. So lots to talk about. So little disclaimer, these statements, the products, they're not intended to diagnose, treat, cure, or prevent any disease. And I express disclaimer on liability. This is educational and informational purposes only and not medical advice. So have your own doctor that you love to talk to about these things and go through them with you also. So I am Dr. Jen. I'm double board certified doctor, and I spent time in the ER and realized that I wasn't really helping people like I wanted to, like I went into medicine for. I was seeing a lot of chronic diseases that it wasn't getting fixed at the primary care doctor. I would keep sending patients back. So I was like practicing integrative medicine on the side and being like, keep a food journal. And, why do these symptoms keep coming back? And then I went back and did a fellowship and got board certified in integrative medicine and still dabble in the ER too. It keeps me very grounded on the fact that people are still struggling. They're still stuck. They still think they're doing everything right and checking all the boxes with their health. But the health that they are getting in the conventional medicine model is not true health. It's big pharma health. It's keep them sick health, or just keep them well enough, but not well enough to not need conventional medicine. So very frustrating, especially when about 75% of the things coming into the ER still are things that could be prevented, like chronic things like, heart disease and strokes, even though we are told that, or cancers. We saw on the Super Bowl all these breast cancer commercials. Well, if they were really that serious about it, they would stop making products that create breast cancer. So, but you all are smart on here and you see through the lies. I co-authored a book, Eat, Sleep, Move, Breathe, with one of my colleagues from my fellowship. I'm coming out with a new book this spring, which will be exciting. I'm a board member for Invisible Disabilities Association, which is a great organization. If anyone ever wants to get involved in IDA, sit on the board, or just find out more, please contact me. I'm vice president of the Northwest Ohio Osteopathic Association. So not only did becoming jaded in the ER with conventional medicine, I had my own medical problem of an autoimmune disease, Hashimoto's thyroiditis, which looking back, I can see when it developed and why it developed, but no one told me I could even reverse it until I did it on my own. So your body can heal itself. I'm also very passionate about Jesus and faith-based medicine. So what are peptides? We hear this thrown around a lot. We hear collagen peptides. We hear, just the word being thrown around a lot, especially now on social media. I feel like everyone is just talking about it and they might not really understand it. So peptides are short chains of amino acids. We know amino acids make up proteins. So peptides are small proteins. So they're not really considered the protein that you eat, okay? They're made up of 2 to 50 amino acids, and these play a role in cell signaling, healing, and metabolic processes. GLP-1s like Ozempic, semaglutide, Wegovy, tirzepatide, all of those are peptides that help with metabolic processes, right? Those are kind of why peptides exploded, because we heard them in the news and celebrities using them. But peptides are naturally occurring in the body, most of them that we use. Peptides regulate our hormones, our immune function, neurotransmitters, tissue repair, and this can impact our muscle growth, can impact fat loss, brain health, and they can be anti-aging. Peptides are a great way and form of longevity medicine. Really great if you have, really, I joke with people, if you have the resources, use them. The only downside side of most peptides is the cost. And if you don't like injecting yourself, but really, like, a lot of them are just brilliant. They're used not only in biohacking, but medicine. So therapeutic peptides, we love BPC 157, TB 500, CMAX, and CJC 1295 are some that we use a lot, and they can help with healing, cognitive enhancement, and optimizing our hormones like growth hormone. They're administered so many different ways, and this is where compounding pharmacists are going to be your friend if you're a provider looking to use peptides more. And if you are a patient out there, someone looking to work with a doctor for peptides, they will work with a compounding pharmacist. You can get these injected via subcutaneous route, which really isn't that painful. It's not that bad. Nasal spray, we'll talk about the one I use later, and oral form, which a lot of people really like that, but sometimes they just don't work as well. But as we will talk about later, sometimes it's the only option we have that's a safe option. So most peptides are subcutaneously because that's going to work better, because there's no risk for breaking down the peptide or those short chains of amino acids before they do what they need to do. Because in the gastric juices, sometimes they can be degraded or broken down. So we have peptides in our body. So people are like, oh, peptides, what are they? That's just a biohacking thing or a drug thing. No, we have peptides in our bodies. These are the original gangsters of peptides. Insulin, we all know insulin. We need insulin. We don't want to be insulin resistant, but we need insulin to live. So insulin is produced by our pancreas, regulates our blood sugar by promoting the uptake of glucose into our cells for energy or for storage, which we don't want that, because that's how you gain weight. Oxytocin is another peptide that our body naturally makes. It's the love hormone. This plays a role in social bonding, childbirth, and also lactation. And this is what promotes uterine contractions and milk ejection. It's also it's the love hormone. If you give people hugs or cuddle, oxytocin is released and you just get that moment, right? All the cuddling. So think of that as the love hormone, the cuddle hormone. We have growth hormone. Growth hormone stimulates growth, cell reproduction, and regeneration in humans and animals also. And this plays a key role. We need growth hormone for childhood growth. We want to make sure our kids are growing. And it's also really important for muscle mass maintenance and metabolism regulation. And this one, growth hormone secretagogues are very popular in the peptide world because it does help with that growth factor in maintaining muscle mass, where, sometimes bodybuilders or whatever, they might abuse like growth hormone. You don't want to do that. Growth hormone secretagogues are safer because it's helping your body produce more of your own growth hormone. But these are great for anti-aging to help maintain that muscle mass. So think of peptides as like a lock and key. So they're going to be working more naturally by binding to these specific receptors, the locks, and activating that biological process the way the body actually intends. So they signal to the body what to do and how to get the cells to work, okay? Whether it's healing, growing, or regulating hormones. And this isn't like forcing it. It's not like a bulldozer going in there. So they typically enhance function as opposed to like disrupting normal bodily function, is how I try to explain peptides. This is versus like a crowbar, right? So you're going in there and you're opening up the door nicely, and your cells and body they're happy. As far as like a crowbar, you think of like going in there and like retching and forcing your way in. And sometimes medications do this, which sometimes medications are not good because they have side effects. So when drug companies are coming out with medications, they have to make sure the side effects aren't worse than the benefits, okay? And this risk ratio that in my fellowship in integrative medicine, you have to look at, the level of evidence versus the risk, right? So this is important with medications, and many drugs shut down receptors or they flood the body with synthetic compounds. And you could be dependent on it, like opiates for pain, or you can have negative consequences like NSAIDs, painkillers, opiates and NSAIDs. They both have really bad side effects. NSAIDs can actually lead to gastric ulcers and really hurt that gut, okay, and break down that gut health and that lining in the stomach. Another good example is birth control. It's forcing their way in there. That's a synthetic estrogen. Lots of risk factors, lots of side effects, but also depletes the body of B vitamins and other nutrients. So that is not good. That's not working with your body. So it is taking something away. So let's talk about some problems I see with peptides and how they're used. So I've been using peptides for over a decade. And one thing that I see that is a negative is some people, they don't prep their body first. So what does that mean? They see this shiny object on social media or hear about it on a podcast, and they're not working with someone that's used to using peptides. So they just take them, right? It's not that it's going to have a really bad negative side effect. It's just might not work as well as if you prepped your body. Okay. If you did the things to kind of clean up gut health or reduce stress or help sleep, more natural ways first, like easy, low hanging fruit, and you just jump right to the peptides. So you might just be wasting some money or just not getting the optimal effect. Or you might be like, yeah, this didn't work at all, or I didn't feel that, this was working. And it still might be, it's still going in there, still healing the gut. But if you're still eating gluten and you're trying to use BPC 157, it's like you're not going to get maximal benefit. So I always love to prep the body first. And this is what I do with patients is the first couple of times we meet, we ask about their sleep, their hormones, their gut health. Is their thyroid working well? What's their diet like? How's their sleep? Are they sleeping with 7 cats, or did they kick them out of the room? I'm not using that as not saying that I've ever let 7 cats sleep in my room. No, I'm just kidding. Maybe when Chip's out of town. But seriously, like these things disrupt sleep. So if we're not prepping our body first, we're not giving peptides like the attention they deserve. We're not giving them the best chance. But is it going to really do harm if you just start taking a bunch of peptides? Not really, but we don't want you to waste money, and we want you to get the maximum benefit. So definitely prep your body first. Use peptides appropriately. So this is another problem, especially with the GLP-1s. We see really high doses right there. My compounding pharmacist that I use for my patients, she said that like these med spas were using the GLP-1s and they had just started using peptides, and they were giving really high doses right away. And like a patient went to the hospital and kidney failure because of it, because they had so many side effects because it wasn't the proper dose. They were throwing up and couldn't keep anything down. So yes, there could be side effects if the dosing is inappropriate or they're not being used. The other concern is contaminated peptides. So LPS or lipopolysaccharide, they could be in peptides that you get from online sources, even though they say they're clean, but we don't know because it says right on the bottle for research use only, not for human use. And I have people that have gotten kind of desperate that I know that have ordered from those places because they couldn't get them from the compounding pharmacy because of the FDA bans. But is it worth taking that risk? I don't know. I had one of my colleagues, and there was a peptide, a neuro peptide that she really liked. And she's like, yeah, I used it from one of those places, but then I freaked out afterwards and was like, what if it was contaminated? And I just don't play that game. So I patiently wait, thymosin alpha 1. I didn't have it in my toolbox for a year and a half. So instead, I have my patients take TB4 frag, which is oral, and Thymogen, which is oral. And we got by. We did okay. Did we want the thymosin alpha 1? Yes, but we waited and it's back. And there are so many good physicians and pharmacists out there that are, fighting against this. Like we should have the right to clean peptides. We shouldn't be getting them from China that aren't even safety tested. So this is where people are battling, and I'm patient. I don't recommend peptides from those other places. I will still teach about them, but I just can't unless I know that they're super clean, right? And if there is one that I'm super 100% confident in, then that would be great. So work with a peptide literate doctor. This is important too because research changes, laws change. We get to learn more about peptides. There's a lot of research on peptides, but we don't have, double-blind placebo-controlled studies on humans in them. Some of them are coming because drug companies are looking to use them. So then we have that, but then they might not be available to us. So it's this seesaw, right? But I think of it as what's the likely to do harm. Even recommending certain diets to certain people could have some sense of harm if you don't know the patient or what they're doing. So it's this risk benefit ratio. And if there are possible risks for using a peptide like growth hormone secretagogues, you need to take breaks. You can't be on them all year round, all the time. You need to check a IGF-1 to make sure your insulin-like growth factor isn't getting too high, right? Because we don't want to push too hard with the growth hormone secretagogue. So it's this balance, and just having a talk with your peptide literate doctor about it. How long have they been using them? Are they in a group of physicians that they can learn from? Do they have a doc? I have a couple doctors that I can text and be like, where are you getting your FOXO4 from? Or I have a patient that just had a stroke, or it wasn't a patient, but it was like one of my friends' family members. And it's like, where can we get cerebral lysin from a good source? So these are things that it's important to look for when you're deciding to take the jump into peptides, especially injectables. So let's learn about two peptides that I picked. Okay. And I picked these because you can get them in oral form. So they are available to you guys. The first one is BPC 157. And this will roll off the tip of your tongue once you learn about it and once you get excited about it. Because I remember when I first started learning about peptides, it's like a different language. They're so funny. They're different names. And then I started naming my cats after my favorite ones. So if you do that, just start naming animals after peptides. So we have MOTS-c, which is one of my favorite mitochondrial peptides that we can't get right now. Our stray cat is named after MOTS-c, and then FOXO4. FOXO4 is another one of our cats. Anyway, BPC 157, a synthetic peptide derived from gastric proteins. So they found this peptide when they were doing some research in animals, and they have found that it has healing, regenerative, and anti-inflammatory properties. So this is a peptide. It's made in our gut and our gastric juices. It is great when taken orally or by mouth for ulcers, inflammatory bowel disease, such as Crohn's or ulcerative colitis, gastritis, and leaky gut syndrome. Actually, a decent amount of research with Crohn's and UC on BPC 157. Why it's not well recognized by conventional GI doctors, I'm not sure why. I mean, I'm thinking in the next 2 decades, maybe it will be a part of the protocol. Also great subcutaneous for tendon and ligament injuries, muscle tears, joint damage, and bone fractures. There's study with rats where they cut the Achilles tendons of the rat and they administer BPC 157 and it helped regenerate tendons. So this is also great. This one is unfortunately on the FDA restrictions for injectable BPC 157. That happened about a year ago. I think a year ago in November, December. We were still able to get it till like January of last year, but great peptide. Also some studies on TBI, traumatic brain injury, and peripheral neuropathy. Wound healing, I would love it when I was able to get this compounded with GHK copper peptides. And sometimes I would throw in KPV with BPC 157 and wound healing. Amazing before and after picture of a patient that had developed from almost like an abscess. It had scarred down and it was open and weeping. Had some bad advice at urgent cares and made it worse by putting like more stuff on it. So we calmed it down. Within a week, it looked amazing because the BPC 157 mixed in there with the other peptides really just helped the skin heal. We weren't forcing it. BPC 157 goes in there, that peptide, and it works with the skin and it helps accelerate the healing of skin wounds and it reduces that scar tissue formation. Inflammation and pain helps reduce inflammation by alleviating pain from the injuries also. The mechanism of action, it promotes angiogenesis or increased blood vessel blood flow by increasing the expression of VEG or vascular endothelial growth factor. So this improves the blood supply to the damaged tissues and this enhances the delivery of nutrient and oxygen necessary for repair. There's a study that I remember BPC 157 paired with GHA copper peptides, which is a known skin peptide, but they put them together in like an open wound, and they compared it with like using, I think they used topical steroids. It was from my talk at A4M. I need to look it up, but it was better. They got better outcomes. And I'm like, why aren't we doing this? Why aren't we giving patients the best? So also, this stimulates the production of collagen, which we know we all love our collagen, and other extracellular matrix components. And this helps with the repair and regeneration of tendons and ligaments. And it also enhances the migration and proliferation of fibroblasts, which is crucial for tissue healing. And that's similar. GHK copper also stimulates fibroblasts given topically. The anti-inflammatory properties help reduce the swelling and the pain in the injured sites, and it modulates the inflammatory response by decreasing the level of pro-inflammatory cytokines and increasing the levels of anti-inflammatory cytokines. And that's really important when we look at healing and what's going on to that actual muscle or tendon. We get those bad cytokines coming in, they're kind of breaking down the tissue. It helps stabilize the gut lining. This is oral BPC 157, and promotes healing of gastric tissues and protects damage from NSAID. And there's actually studies showing how BPC 157 stabilizes the gastric mucosa against NSAID. So if anyone has to be taking NSAID, you should be taking BPC 157 along with that to mitigate the possible effect of like ulcer or leaky gut and all of that. So dosing, usually it's about 500 micrograms once a day, okay? And you want to take it on an empty stomach for better absorption, and this is the oral dosing, and it's divided into 2 doses, occasionally taken morning and evening. But for easiness, for patients in compliance, I usually say 500 micrograms on an empty stomach once a day. And then for injection, 200 micrograms to 500 per injection once or twice a day. And that's administered sub-Q. But if you are going to a doctor, they can inject these around or near the joint, or sometimes patients can too. The next peptide that I love is lorazepatide. This is an intestinal tight junction peptide. It regulates and helps reduce intestinal permeability. It's also known as AT-1001. It's a synthetic 8-amino acid peptide. This inhibits zonulin release. We'll go into detail about zonulin in a minute. It helps stabilize those tight junctions in the gut. So you have your gut, and it's about the size of a tennis court, is one cell lining thin, I should say, or thick, but that's the intestinal barrier, which is protecting your inside from what's on the outside, right? Because we have our mouth is open and our anus is open, and mouth to anus, then it's enclosed. So that's what's protecting it in that stomach lining, okay? Lorazepatide actually also reduces intestinal permeability, which is leaky gut when we have open tight junctions. And because of how it does that and how it works through zonulin, through helping those tight junctions, we're having diminished immune activation. Because when we have things pass through, particles, food, whatever, that shouldn't be there, then we get that immune reaction. We get autoimmunity, we get inflammation, we're puffy, we get something else, we get sick, all of that. So zonulin, if you haven't heard of zonulin, when zonulin levels increase, the tight junctions, which are our gatekeepers to our gut, they loosen, making the gut more permeable. And this is leaky gut. So increased zonulin opens those tight junctions. And when those tight junctions are open, that's leaky gut. So what triggers this zonulin release? Well, gluten. This is why, if any of you listening are a patient of mine, I have you go gluten-free, because we know that gluten activates zonulin and opens that up. So when people come to see me, most of them have leaky gut. Because why? Well, why are they seeing? They might just want to. I love when I get patients that are just like already gluten-free and they're just like want to do anti-aging and longevity. But most come to me because they're struggling, right? And most of them have leaky gut or intestinal permeability. I had leaky gut. That's why I had Hashimoto's. Oh my goodness. I could tell you all the reasons why I had leaky gut. It's crazy, but it's so common and it happens, and we don't know or talk about it enough. We need to normalize talking about leaky gut at dinner, at whatever. I do, but anyway. Dysbiosis, gut imbalance. So dysbiosis can cause leaky guts. You have the bad guys, it's like having open borders in your gut. I don't want to get political, but like that's what it is. If you have these bad guys coming in, you need to close that down. So the dysbiosis is when you have a lot of bad guys in there and they're like breaking things down, they're releasing zonulin, it's going crazy. So candida, mold, fungus, small intestinal bacterial overgrowth, those are all bad guys that we want to keep out. They need to go. Okay. We only have so much good bacteria. When those bad guys get out of sorts, out of check, we can't get them out. I say it like, every town has a few bad guys, and you have enough good people in the town and police to like keep it in check. There's not chaos. But say you have a couple of like gangs come in, there's going to be issues, right? You got to get them out. You can't just live there with them. Unfortunately, you can pray for them, but you got to get them out. You just do. So that's what we have to think about, is like, we'll always have like some like, candida in there, I mean, I have Clostridium, that causes C. diff from working in the hospital. I mean, if you work in the hospital, you have C. diff in your gut, but it's under control. The good guys are keeping the bad guys under control. All right, infections and toxins. We just talked about that. Glyphosate can do this if you live in the Midwest. I won't for long. All right, inflammation and stress. This is another thing. If you are stressed all the time, you will get leaky gut. If you fixed your leaky gut, but you didn't fix the stress, you will get leaky gut again. Now, here's what you can do, and this is what I do. If I know I'm more stressed, I will take some peptides. I will double down on my diet. You can do that. You know that. I help teach people that. Okay. So say you're going through a really stressful time, maybe take some lorazepam. I've been taking lorazepam for the last couple of weeks because I'm moving. So I know that things are going to get a little wild. And I will never say to anyone, just don't stress about things. No, we have stress. We're going to have stress. But how do you deal with that stress? I pray, I give it all to God, right? Jesus helps me, and my stress levels are lower because of that. But it doesn't take away the stress, but we need to deal with it better. And then don't watch the news. Don't do triggers. Don't hang out with that family member that's going to stress you out, right? So just boundaries too. Okay, that's important because it happens so much. People do everything, but they're still stressed. This is what I was talking about. I love this little diagram. So this is what the gut looks like. Like, look how cute. It's one cell thick. That's it. Size of a tennis court. Okay, these tight junctions. There's good bacteria in there. They're protecting it. Akkermansia is there, producing mucus, eating mucus, keeping that tight junction healthy, keeping that line healthy. But then in the food particles, just chill. They bounce, they go out in your poop, you digest them. When we have breakdown of the mucus barrier, breakdown of the tight junctions, zonulin opening the tight junctions, I think I see a little H. pylori in there digging in. Then it's the viruses, bacteria, gluten, toxins, all of that. Then you're getting bad tight junctions and you're getting leaky gut. And it's so important. This is health, right? This is mental health. This is autoimmune health. Every doctor should be talking about leaky gut, no matter what their specialty. Okay. It's like my soapbox. Lorazepam, clinical uses. All these clinical uses are what drug company, this is in like phase 2 trials, I believe, lorazepam for celiac disease, and also some other things like IBS, maybe, I think kidney stuff too. I haven't looked within the last 6 months. So anyway, these are all the things that lorazepam can help with, because those are all things that are caused by leaky gut, right? Anyway, but amazing, right? I mean, but you guys know all this if you know me, and I talk about this stuff all the time, but this is where lorazepam can be helpful. Dosing, 0.5 milligrams or 500 micrograms twice a day is my usual dosing. Maintenance, I will tell patients like 500 micrograms once a day is okay. I will go up to 3 times a day. I had a patient, chronic diarrhea, had to wear, like briefs or whatever to help with the diarrhea, like couldn't even go, very affecting her life. We did the basics, we did all the things, but we also started lorazepam, and I had her up to 3 times a day, and she was finally able to go on trips and like not, and to go out without, diarrhea, just like coming out all the time. And she was able to get off the lorazepam, right? This is another thing. Peptides, is it a forever thing? No, you cycle them and you get better and you improve. So let me see how we're doing on time. Pretty good. There are just some of the references. Okay, I get this question all the time. What peptides am I taking like right now, like today, like February 10th? Well, within the last like couple weeks, I play around sometimes. All right. Thymosin alpha-1. It was back. It came back. I think it was the end of September, early November, and I did a happy dance. I was so happy. It might be taken away again, I just read. But right now we have access to it. So I started a lot of my autoimmune patients on this, my Graves patients, my Hashimoto's patients, my injured from vaccine patients. I put a lot of them on this. It balances the immune system, the Th1 and Th2 immune system. Thymosin alpha-1, love it. So I will also use this if I'm traveling. I will use it a couple days before and a couple days after, or if I get sick. If you get sick, this would be a good one to take. So it helps support the immune system. Also, they have used it for viral infections, for cancer, for all the things, because the immune system is very important for all of that. And if our immune system is not functioning properly, we're going to get autoimmune diseases, we're going to get cancer, we're going to get inflammation. But also gut health, right, plays a role there. I am microdosing in GLP-1, tirzepatide, really, really, really small dose. Like you couldn't get it from the pharmacy. So I'm doing this for inflammation. I'm playing around with it. It's not doing anything for hunger or muscle because it's such a small dose, just for inflammation. So I decided to play around with it because I've been using that with my patients for so long. And I think it's good. I personally have to still detox from toxic mold. I'm finally allowed to right now because I'm not pregnant or breastfeeding really anymore. So that's something that I want to try to get out of my system for good. Bioregulators. I am on a year's worth program that I do with patients. And if they opt into it with the bioregulators. So I'm taking different ones this month. I think taking kidney, thymus, pineal, and gosh, what am I on? I'm on one more, not ovary. Getting it mixed up with my husband. He's on 5 this month. So we're each doing different ones each month. And this, how did I pick the bioregulators? I'm rotating through all of them with a focus on my OCMI age. So I have a podcast on this. So I did my biological age and the age of all my organs. So I'm looking to make them younger and reverse that through bioregulators, which is a whole nother hour subject. I'm taking BPC 157 with some lorazepam as needed. If I feel my gut getting a little wonky, like I said, I've been kind of taking lorazepam on and off the last few weeks just because I just feel a little like I just want to protect my gut. And then nasal PT-141 and oxytocin as needed. So PT-141 is used for sexual enhancement, and oxytocin is that love hormone, so that can also be used. So really nice combination that you pair these two together. You use intranasally each nostril 30 minutes before intercourse or expected intercourse, and it can really enhance that. So you can also get PT-141 subcutaneous, but the side effects go up a little bit more then, which like are headache and dizziness and nausea. And I'm like, I don't want those side effects if the goal is to enhance sexual, enhancement with my husband. So I just do intranasal and I like to have that on hand. So that's what's in my fridge right now. So, okay. So I want to still have some time for Q&A. So now what? I wanted to give you guys some information on peptides. And now I want to tell you what you can do after today. So if you live in Ohio, Michigan, Texas, or Tennessee, you can shoot me an email and I will drop these in the chat in a few minutes. You can shoot me an email to set up a discovery call with someone from my team. So you can work with me one-on-one. I'm doing patient packages. I am accepting select patients right now, especially after we move in 2 weeks. I'll definitely have some more free time, so that will be great. So you can always set up a discovery call by shooting me an email if you want to work one-on-one and get to the root cause of things, or you want a second opinion. I just had one of those today. So working with someone that actually was just really kind of like, whew, the other way, with a provider. So we're bringing it back in. You can enroll in my peptide course. So starting March 3rd, I will have a peptide course. It's going to be 4 modules. It's an excellent course. So I actually taught this last fall, early fall, and I'm ramping it up for a course so you can just go back and look at it anytime, and everything is printed out. So this is a limited time. Oops, that's later. Sorry. So this is limited time offer for $49 for the course. It will be dripped out for 4 weeks in March. It will be, so like what I presented today is just like a little bit, right? You're going to be getting so much more information. So probably like 4 hours of information each week. And dosing, I'll talk about what all you'll get later. And the price will go up to its cost of $99, February 28th. You can buy peptides. We spoke about a few. If you go to healthybydrjen.shop, you can use code PEP15 for 15% off peptides. So a little bit more about the peptide course. So this is for anyone that wants to gain expert knowledge on peptides and their applications, their clinical application, have patient stories. I'm also going to teach it. You're going to have it in the module, but I'm also going to make videos. So you're going to learn about how I use it, some case studies I've seen, what works, what maybe doesn't work. You're going to learn safe and effective dosing protocols, because the dosing protocols are very important. And you're going to unlock biohacking strategies for performance and longevity. So if you yourself want to use peptides for performance and longevity, we're going to talk about that. We're going to talk about bioregulators. I love bioregulators. They're just oral too. So a lot of the times that is a lot more agreeable to patients. I don't know. I love taking the bioregulators. I feel really good since I started. I won't have my results on how much younger my organs are getting till next year. And it will be interesting because if I age in reverse after having a year of shutting down my brick and mortar and moving and being in perimenopause, that would be amazing. That would be so amazing. I'll also discuss dosing and then stacks. So the different stacks and why you'd want to use certain peptides together. You guys saw my stack for right now. And also how to cycle peptides, because you do want to have them cycled. You don't want to push down that gas pedal for long. So that course will be $49. So that's $50 off for you guys. I feel like I'm going to sneeze. That price will be good until February 28th, and then it will be $99. Okay. So the course is $50 off for you guys. And once I get off the screen, I will drop the link. Okay. And that's kind of everything, guys. So let me stop my share and drop those links, and I can answer some questions for a little bit. So I will look in the chat for questions first. So there is the course. I will just drop all these at once. All right. So that's the course on Kajabi, and that will start March 3rd. If you are interested in a one-on-one, you would want to email me at info@phlegmed.com. We will get you set up with a discovery call. And then if you want to shop peptides, if you click on that link, the peptides are on there. I will be sending out a replay also, but with the peptides, I will restock them. I'm moving. So right now, if you order through Friday, you will get them ASAP, but they'll restock next week. So if there's something that's out of stock, I will be restocking. Okay. So I am going to now go to questions, and Thanks for being here, everyone. I'm going to pause.